Lagos State is intensifying efforts to sustain the gains recorded in the fight against malaria as it moves towards a malaria-free future. The state government has revealed that only about 5% of fever cases in Lagos are caused by malaria and has directed healthcare providers to confirm malaria through rapid diagnostic tests before administering treatment. We have details in this report.
For decades, malaria has remained one of Nigeria's leading public health challenges, with many fever cases treated as malaria without laboratory confirmation. However, new findings from the World Bank-supported impact project suggest that the narrative is changing in Lagos State. At the project's dissemination meeting, stakeholders reviewed the impact of improved diagnosis, stronger surveillance and expanded access to malaria services. The Commissioner for Health, Prof Akin Abayomi, urged healthcare providers and residents to move away from presumptive treatment and embrace testing before medication.
What we're doing in government is not just about government facilities, but it's about the private sector. And the private sector must listen to what the government is doing, and we're proving it in the public sector that malaria is not that common. And we're proving it by making sure that everybody that presents with malaria symptoms or fever gets a test. And so it is only through these modalities that we can identify where the hotspots are and that we can target environmental interventions.
We went far and beyond just to make this happen. The riverine area, the very difficult, hard to reach places, to ensure that that message, that service, that commodity gets to those people, so that as a totality we can actually end malaria in Lagos State.
In addition, we also put in place what is called a grievance redress mechanism program, where people at the community level will be able to complain if something is happening in their primary healthcare center and they're not being provided with the right care. And so we're able to put that in place in all the wards in Lagos State.
He also called for stronger collaboration with the private sector to sustain the gains already recorded. Although the impact project has come to an end, stakeholders say the work is far from over. The focus is now on sustaining the gains through stronger government ownership, continued community engagement, and evidence-based health care.